well, so that we plan your pregnancy safe, that your pregnancy is safe and the upcoming child is safe, not having any blood disorder. That should be told. And what is genetic counseling is that in this way we have different investigations for yourself and your partner, and anyone in your family can have this thing. They will counsel you about different tests and they will do different investigations. I would like to give you some leaflet about this condition so you have a read. If you have any severe chest pain or heart racing or anything, you can come back. All right. So this is how you would do in that consultation. So rather than doing this, we'll do another one with the anemia. You will act like a patient. So we'll do a iron deficiency anemia. So I want to tell you guys, sickle cell anemia. So I will do the sickle cell anemia. Is sickle cell anemia is coming in the exam nowadays? I want to do one with the. I'll tell you both of this. So I'll tell you story and how you will be going to judge me on and how you'll be scoring on. Isha will be acting like a patient. So let me show you. Isha. So basically, what we are going to do in this scenario. So again, I'm going to see the results which would show low HB and low iron as well. So macrocytic anemia, that means iron deficiency anemia. And I have to ask, let's do the alcohol problem because that's the most important one. So what would be the only positive finding? In the blood investigation, I would get that vitamin B12 or macrocytic anemia. And that one, macrocytic anemia, everything is negative. Your food is okay, you're eating everything. Your food is okay, you are eating everything. Now I want to add a few more things in that scenario. I want to tell you the script, whole script. So listen, you are 65-year-old male. The positive finding in the history would be that sometimes you do have tingling sensations, sometimes you have heart racing, and your diet is okay, you eat everything, but you drink too much alcohol, and blood investigation, which I will get, which would show macrocytic anemia. That means that is a big anemia over there. Okay, the HB is slightly on the borderline, okay, slightly low, but that the cells type would be macrocytic anemia. Okay, and your diet is okay, you got only one or two symptoms in which you might have some tingling or numbness type of sensations around your arms or legs. Okay, so in this scenario, basically, guys, so you will be judging me. The common presenting complaint, when I will ask you why you came to the hospital last time, you would say, doctor, all the time I was feeling tired. All the time I was feeling tired. So the common complaint would be the tiredness or heart racing. It could be anything. So you would be saying that I would be asking, because in this condition, the patient might have vitamin B12 deficiency as well. So am I asking any, you need to say that I need to ask any ulcers around the mouth, any tingling around anything, any disturbance in the, and any problem with the VN at all because of vitamin B12 deficiency. I'll be asking about problem in breathing at all. I would ask about weight loss, lumps and bumps because it's 65-year-old. And if someone, you're going to see the 65-year-old who got low HB, what I need to do, 67 maybe. If he got low HB, what I need to do, this is what I'm trying to say. So does he have weight loss or not? I will do the floss. As he's tired, I'll try to do further things, and in the methods, I'll try to ask any problem, ongoing problem with the GIT problem or any medication he's on, any family history, and the diet is very important. I have to ask in detail. The diet would be okay. Ice. So in your consultation, Isha, you didn't ask about ice as well. Psychosocial
Yes,
was missing.
I forgot that.
So that was the thing, you guys, don't need to forget that. am I mentioning about tummy examination, everything? When coming to the explanation, I will tell him that you're having vitamin B12 deficiency. If I get the blood investigation in which the vitamin B, when lack of vitamin B12 or folate, and in this way, I will explain him. I might connect it with the alcohol intake as well. Then I will tell him what I would do now. I will tell him that I will try to do further investigations and I will treat you with the vitamin B12 and you go HB, low HB. I would like to treat you with the HBL. First, I would do vitamin B12 injections and then what I will do, I'll put you on the vitamin B12 tablets. Okay, if HB is low, what I will tell. So I'll explain the reason, everything about that. Then I'll come to the diet thing, because if there is no diet problem, I don't need to address. If the patient is having problem with drinking alcohol, then I'll explain that. But I'll try to bring every issue here. The patient is 67. I'm trying to cover a lot of scenarios and different scenarios in one scenario. The patient drink alcohol. If the patient is drinking alcohol, what could be the cause? If patient have vitamin B12 deficiency, how will treat? And the last thing, if the patient is having low HB along with the vitamin B12 deficiency and is 67, what I will do? So I'll explain everything in this scenario bit by bit. So I'm going to put on the timer myself. Okay. Okay, so PLAB timer is on. So I am doctor and you're the patient and your patient name is Michael Brown, okay? Begin. Hello. Enter the room.
Hello, doctor.
I am Dr. Gafar, one of the doctor here in GP surgery, one of the junior doctor. Can you please confirm me your name?
Doctor, my name is Michael Brown.
Michael Brown. Shall I, is that okay? I call you Michael?
I'm sure, doctor.
Nice meeting you, Michael. Michael, just to double check your date of birth, please.
Yes, doctor. It's 5th January 1960.
Thank you very much, Michael. I understand from my notes, this is your second visit. Am I right? In the last two. Okay, good. So can you please give me a recap? I have your blood investigations with me. I'll explain everything to you. Can you please recap your previous visit or why you visited surgery?
Yes, sure, doctor. Doctor, actually, for the past 3 months, I have been feeling